So welcome, Phronsie, and Phronsie presentation will be followed by 10 minutes of question and answer with Phronsie before we hear from the work from the chapter, the team that's been working on this for the resource guide.
All right, thank you. So this is very unusual that I can't see everybody's face, so that makes me a little anxious, but I'll do my best. So as Laura said, my name is Phronsie, and I have been I worked at the hospital for 12 years, 5 years as a social worker, and my last year was as kind of focusing on sexual issues and chronic illness. So I'm super excited to be asked to come to talk. I don't know that I will actually talk for 20 minutes straight, though I'm sure I can. I much prefer to spend time answering questions that you actually have, as opposed to trying to guess what you want to know. So I'm going to start with talking a little bit about coping with chronic illness and intimate relationship. In my years at the hospital, that was one area that I noticed was pretty neglected. Doctors aren't often comfortable talking about sex or sexuality, and can often be dismissive, which is really frustrating for folks who are in relationship. So chronic illness, as you know, comes with a wide variety of challenges, including fatigue, pain, fear, worry, loss of libido. And when we lose these things around sexuality and don't have resources to talk about, it can be really devastating to relationship. So some of the things that over the years I've worked with people on are developing flexibility when defining what sex is. In our culture, we have a group of people who really support a penis and vagina model of sexuality, which isn't necessarily helpful to people who don't like penis and vagina, or to people who are unable to engage in that type of sexuality anymore because of a wide variety of issues, some of it just from aging, some of it from these chronic health conditions. So when working with people with chronic illness, talking about having a pleasure-focused model of sexuality as opposed to a goal-focused model can be really, really important. Part of that journey is taking the time to get to know and learning what feels good to your body, what used to feel good when you were younger or your body functioned differently may not feel good anymore. It doesn't mean that there isn't pleasure to be experienced. This can be challenging if you don't have the ability to talk about sex, or you've never been comfortable with the sexual parts of your body. So kind of spending a little bit of time getting to know where you're at. And this is what I do in the sex therapy model. It's hard to give pointers without individual questions. Developing intimate communication skills with your partner is really important. Often in partnered relationships, we don't talk to our partner about sex and sexuality. Talking to them about sex in and amidst all of the other relationship and chronic illness and processing can be even more challenging. So kind of taking steps to develop those skills can be really helpful to be able to communicate with your partner about the changes in your body and about what your needs are, and to set boundaries and limits on your sexual relationship. Common struggles that I have worked with in folks with cancer and who are on dialysis include low libido, fatigue, pain with intercourse due to either intervaginal pain, muscle pain, kind of cramping type things, or caused by vaginal dryness. Not understanding the arousal cycle. When we are young and full of hormones, we often experience spontaneous desire. Yay, I'm ready for sex. When we're older and or have chronic health conditions, sometimes we just don't feel spontaneous desire. We're tired, we hurt, it's just not great. So kind of knowing that there's different ways to approach sexual intimacy, and spontaneous desire is only one of them. Sometimes there's fear about engaging in sexual activity when you have a lot of health conditions going on, just because what if we're in the middle of it and something happens and I need to stop, is that okay? How do I talk to my partner? How do I know I'm having struggles? And sometimes we get into the habitual no, that we don't even stop to check in. Do I want to engage in sexual intimacy with my partner? Because we've been in a place for so long that says, I don't have any desire, I don't wanna. And we start to notice problems in our intimate relationships and just respond with no. So some of the work that I've done is helping people really kind of scale. Where are you on your yes to no of sexual function? 1 being, yay, I'm all in. 10 being, 10 being, hell no, I don't want to. And how to kind of differentiate that and communicate that to your partner so that there aren't those feelings of rejection, loss, and disconnect. And I am happy to go into detail in any one of those areas. I would love to know what you all would be more interested in hearing about. So if you can, if you're comfortable unmuting and asking a question, or if the format is just to post it in the text box, I will open my text box to read those.
Hi, Phronsie. My name's Jennifer.
Hi, Jennifer.
So one of the things we're noticing somewhat of a common trend with women with CF is experiencing vaginal dryness, low libido, and painful sex. So we're not sure, because of the lack of research up until this point, why that is. But would you have like anything that might help with dealing with our chronic health issues, on how we could start to tackle one or maybe a little bit of all of those 3 things to have a little healthier or better sex life?
Sure. So from a practical standpoint, especially for pain with intercourse, I often suggest to clients to meet with a pelvic floor specialist if there is one in your community. They have spent a lot of extra time being trained to help people connect to their pelvic muscles and vaginal muscles, and they have a wide variety of therapies that can be helpful in helping relax some of that if it's muscle tension, helping tighten some of that if it's lack of muscle tightness, and they can be super specific and tailored to your needs. And they can also sometimes, with varying conditions, like I know with our cancer patients post-treatment, or when we induce menopause because of the treatment we've given, or they've had radiation to the cervical area, the vaginal muscles atrophy and the vaginal canal starts to close. So we support clients with learning how to use dilators and how to kind of overcome some of the angst that can come with using dilators to help them meet their intercourse goals. So I think pelvic floor PT is a really great place to start. For vaginal dryness, there's a wide variety of lubricants out there, most of which cannot be bought in Target or Walmart. So I encourage people to kind of look up more brands that have more natural ingredients in them, less preservatives, less chemicals, all of that. A couple of those are like Sliquid, Sensuva. There's one called Good Clean Love, which is one of the few that you can buy in Target or Walmart. And just trying, they're water-based lubricants. They're have pretty good ingredients in them, so they're not going to aggravate or contribute to vaginal tissue struggles. And then just kind of being aware that lubrication, the way most of us use it without any education, is inadequate. It's, you know, like a nickel to a quarter size even, as opposed to like, I'm just gonna put a little bit here and we're gonna call it good. And if you're with a male-bodied partner, of lubricating both the penis and the entrance to the vagina is really important. And if you're going to be engaging in penetrative sex for longer than a few minutes, of relubricating as you go can be really helpful. Low libido is kind of being approached from a wide variety of areas, right? We don't, sometimes it's fatigue induced, sometimes it's stress induced. And so when we're kind of looking at ways to, sometimes it's I've lost connection with my partner induced and I just don't even know how to get back there. So working on each of those areas can be really helpful and supportive to kind of reinvigorating libido, or at least inviting in some curiosity about maybe sex still feels good. And, you know, low libido often implies I don't experience spontaneous desire, but I might engage in some physical activity with my partner and still find it enjoyable. So then we're wanting to work kind of past that habitual no of maybe once I'm aroused, I'll have desire. And so how do you say yes and engage your partner in sexual play to see what happens? And how do you talk with your partner about saying no if it's just not working that time? Does that answer your question okay?
Phronsie, this is Laura. There are a lot of questions in the chat.
All right.
One of them is talking to your partner.
Mhm.
It's way up at the top now. It's George's question on communicating with your partner at all. So that's, and then there's a number of them coming. So
Okay, great. So communicating with your partner, in general, this is a really challenging thing to just give kind of a blanket, like, here, do this, because each relationship has their own communication style. When I see people in my office, we talk about how they communicate now and what's working, what's not working. And that what I have found is if you can communicate well about most subjects, transitioning into communicating about sex can be easier. If you can't communicate about most subjects, jumping into communicating about sex doesn't usually happen because there's too much tension or conflict around those hard conversations. One of the books I do recommend for people who are curious about changing communication with their partner is a book on nonviolent communication. And it just really kind of talks about practicing listening and kind of trying to pull out some of those defensive behaviors. And the fun thing about sex is the more you talk about it, the easier it gets. So the first few times you talk with your partner about sex, it's going to be awkward and sometimes uncomfortable, especially if there's animosity because you're maybe somebody's feeling like you don't have sex enough. So I don't have an easy answer for that one. I'm sorry. But I think like the nonviolent communication book has some good tools in it. And sometimes a few visits with a couples counselor can really help open up communication to allow that part to start.
the next question, Phronsie, is about scarring
Mm-hmm.
and vaginal scarring from tearing and also infections related to CF from all of the antibiotic use that we have.
Okay, so scarring causing pain or discomfort, or
Can the questioner elaborate?
Yeah, so I've had a lot of experiences. As I mentioned in the chat, I was in an abusive relationship that included sexual abuse. And so I still have scarring from internal injuries from some of the things that happened in that relationship. But then I've also had a few situations where I was just having really vigorous sex. And because of the scarring that was already there, the tissue was very rigid and there was a little bit of tearing and bleeding. And so that's something that my CF doctor now talks with me about it, but that's like the first time I've ever had either a general CF provider or a like vaginal health provider talk to me about that, but it's a very important issue. And so my doctor said that he really talks with all of his patients who have vaginas about you know, how are you safeguarding your vaginal health if you're sexually active? You know, what are you doing to reduce tearing? You know, are you using enough lube? All that. But it's so unusual for me to have had a provider just jump into that without me having to really like force the issue. And I've heard from other people with CF who have vaginas that their providers don't talk to them about this, that they're not talking about safe sex, and what we can do to make sure that the sex that we're having doesn't make some of those existing issues worse. So things like just going slowly, like if you are doing vaginal penetration, just sort of going slowly to really stretch the tissue. And I think, like, obviously those of us who are in the queer community are a little bit more aware of some of these things, especially if we're engaging, like if we're like ever doing like anal penetration with our partners, you know, we know how to do some of these things. But especially like from the straight people I've talked to, that it's like, this is a discussion that's just not being had, but it can make a huge difference. So I wondered, for, you know, kind of what you've seen about what's going on at different CF clinics and in different reproductive health practices that work with people with CF, you know, and where you see the gaps are in what's being done in dialogue with patients and what we can do about that.
Okay, so I don't work specifically with CF intensively. My experience is more broad. What I can add to that is that, yes, what you're seeing with other medical providers is absolutely, I think, what we often see here. It's really difficult for doctors to often talk about sex or sexual health. Disappointingly, even OBGYNs will just say lube up or looks fine to me, and it's not fine. So those are definitely challenges in the medical community. You know, I see some positive things with some of the younger med student docs who are taking the time to take extra classes in sexuality and sexual health, and I'm like, yay, there's hope. But I think just continuing to advocate for that need in the office and additional training. And really accessing pelvic floor rehab, I think, for like scar tissue manipulation and different tools and resources for supporting, kind of helping loosen up that rigidity that's caused by scarring. They can be really, really helpful. If I were in my office, I'd open my big pink box of fun, and in it I have like a glass dildo that is specifically designed for, it's got bumps all over it. So it kind of can massage the tissue, which can break up the scar tissue a little bit. And people are like surprised to know there's a mechanism to do that for humans who have vaginas. So I think that advocacy piece, you know, just for doctors to need to be informed and to not dismiss. I think too many, A, don't ask the question, and B, when the question is asked, they dismiss it. And people often look at humans with chronic illness or health issues as non-sexual, which is gross, and definitely needs advocacy. So, you know, I know people like myself provide education. People like you, as you're gathering education materials, can provide that to doctors' offices too. And I'm hoping as time goes on, they're going to continue to be receptive to that. My reception's a little better than it used to be, so that's kind of good.
Certainly, PE is something we're already familiar with in the CF community. So I teach medical school, so, you know, my medical students learn all this stuff, but it's like a lot of the time, like, I'm the first person who's talked to them about it. You know, even when there's such an opportunity where the community is already familiar with PT for our lungs, you know, you might need it for other parts of your body too.
Absolutely. I think it's a very underappreciated resource. And I've just seen our pelvic floor specialists be able to do like fabulous things to help support clients and patients.
Phronsie, I have another question, and this is relative to low libido.
Okay.
Different things that layer with that from this community are use of antidepressants, whether you have your original lungs post-transplant, weight issues, and libido, body image, and of course all of the meds that we take, a number of different medications. And when our doctors offer them to us, prescribe them to us, we probably don't talk about the layer of affecting our interest and libido. That's a lot.
Right. And so that's a lot. I don't know that I'll be useful on all of it in this moment, but I will try. SSRIs antidepressants absolutely impact libido. I think sometimes providers are a little overzealous in prescribing. Sometimes they start higher up than maybe would be preferred if you want to have any libido left. For people who have sexual side effects of loss of desire, whose depression isn't more dangerous than wanting to increase desire, then sometimes lowering the SSRI a little bit to where you still have the coping skills you need to be able to be comfortable, happy, safe in whatever that SSRI is treating, either anxiety or depression, and can allow for some libido to return. Sometimes changing antidepressant can be helpful if possible. Often, you know, when I work with humans who experience bipolar or one of the more severe mental illnesses that really are dependent on that medication, then we just talk about how do we invite in intimacy without requiring desire first, and just kind of normalizing that experience. And, you know, often for people, arousal does create an opportunity for people to be like, oh, hey, I kind of don't want to stop what we're doing. So then it's just engaging more thought process as opposed to body responsiveness in engaging in sexual stuff. So there's just so many facets to low libido, right? There's how do I feel about my partner? There's how do I feel about my body? I know when scarring is when physical scarring creates, I'm not comfortable being naked. I'm not comfortable with the lights on. I'm not, you know, I don't feel good in my body. You know, we talk about things like, well, you know, for people, like in my most recent experience, people who have had mastectomies, finding a nice camisole that feels good on their body and doesn't require full nudity can be a solution. Lighting can be helpful. You know, sex doesn't have to be fully naked. It can be whatever helps you feel most comfortable. If body image issues are so severe, then again, I kind of lean into, I'm a counselor, I kind of lean into maybe seeking a little bit of support to navigate some of the changes in your body and the effect on your body image. Positions with chronic illness, some positions aren't comfortable. Maybe you've always done, if you're in a hetero-cis relationship, maybe you've always done missionary, and that's like the position you know, it's the position you like, yeah, it's great. And now that's awful because there's too much lung pressure, it's too uncomfortable. So just kind of opening the door of opportunity to different positions that work with whatever you have going on. Pelvic floor PT, ironically, they have little handouts, little sheets of paper with different sexual positions based on your ability. I worked with a couple once who had 2 new hips, and anything on the knees or on the bed was not going to happen. They're in their 80s, they bought a swing, they're having the sex because there's no weight on either of them. So that can feel really helpful. So sometimes just having somebody that you can communicate with to think out of the box about how to engage in intimate sexual activity when the things that have always worked don't work anymore.
And there's a brochure, Phronsie, from Canada on sexuality for adults, and they don't anymore, but they used to show pictures that reduce pressure on the lungs.
Mm-hmm.
Yeah.
And there's a wide variety of positions that people can use. They're just not ones that you might think of. You know, when you have to branch out of your repertoire. I mean, humans are kind of creature of habit. We like what we like, and when we can't access what we like anymore, it can feel really confusing and overwhelming.
Thanks, Phronsie. There's another question.
I would love for you mentioned at the very beginning that there are many issues that women with cancer and other diseases can have. Like we talked about the like post-transplant body image issues and antidepressant, but are there any exercises, either like mental or physical exercises you can do yourself or with your partner that can help you if you don't have that libido, kind of, as Zan was saying, kind of slowly kind of set the mood, get you ready, instead of feeling like, well, I'm never going to have libido because of these issues and because of my CF.
So one of the books that I have clients tell me they're really enjoying right now, that just focuses on issues of female sexuality in general and all of the struggles that female-bodied humans experience in our culture, of body ownership, of worrying about body image, of all of those things, is called Come As You Are. And I like the book because she's got some really nice kind of entry-level exercises of kind of getting to know your body. And what I hear a lot from people I work with that have chronic health issues and have had surgeries and have had all sorts of things, experiences, they don't trust their body anymore. They don't feel good in it anymore. They've learned their body's going to let them down. And so kind of shifting that focus to like, this is my body and my body is changing, and I have this chronic illness and I'm still surviving it. My body did that too. And then doing some of these exercises of getting to know your body again and kind of broadening that definition of sexuality. So I think that would be a book that I would recommend for female-bodied humans, as something to explore kind of different sexual areas where we get stuck and that may be more impacted because of
Let
what
us
you're
know who
experiencing.
wrote that book as far as note taking for the group.
It's Emily Nagoski,
Thank you so much.
Nagoski.
Thank you.
And if you have questions that you feel are pressing, and you'd like me to answer or give it a shot or offer resources, please send them to Laura, and I am happy to address those and send them back to her.